Mushrooms are the fruiting bodies of filamentous fungus that live above ground. In culinary terms, they are classified as white vegetables. There are around 1,600 mushroom species, but only 100 have been identified as edible, with 33 species farmed for eating around the world. Mushrooms have been consumed by many cultures for ages. Mushrooms were regarded as food of God by the Romans and an elixir of life by the Chinese. Mushrooms are low in calories and rich in nutrients such as antioxidants, fiber, B vitamins, and minerals. Mushrooms that have been exposed to UV light can also contain a high concentration of vitamin D. Consuming edible mushrooms has been related to a variety of health benefits, including better gut and brain health, as well as protection against obesity, type 2 diabetes, some malignancies, high blood pressure, and other conditions. They have been described as the most underutilized nutritional food. Has anti-inflammatory properties. Mushrooms are one of the most effective anti-inflammatory foods. Chronic inflammation in the body has been related to autoimmune illnesses and chronic diseases, including heart disease, cancer, and neurological diseases such as Alzheimer's. Several bioactive substances present in mushrooms have been demonstrated to have anti-inflammatory properties, which may help protect against a variety of ailments. Beta-glucans, for example, regulate pro-inflammatory chemicals known as cytokines, which are connected to chronic inflammation in the body. May help with diabetes prevention and treatment. Mushrooms are minimal in calories and have a low glycemic index, which indicates how rapidly blood sugar rises after eating a food. While research is limited, studies have demonstrated that natural chemicals found in mushrooms assist lower blood sugar levels by limiting the absorption of glucose sugar from the digestive tract into the bloodstream. They may also improve pancreatic function and insulin secretion. Mushrooms can be a good source of vitamin D. Research has found a relationship between poor vitamin D intake and insulin resistance. Insulin resistance occurs when cells do not respond to insulin, preventing sugar from being adequately removed from the bloodstream. This can cause type 2 diabetes. Offers obesity support. Mushrooms may help fight obesity. According to a review of data, this could be attributable in part to the anti-inflammatory properties of mushrooms. Mushrooms provide a number of benefits for weight management. They are low in calories, take longer to chew, and contain plenty of moisture and fiber. They also delay stomach emptying and increase feelings of satiety. Furthermore, mushrooms have been demonstrated to alter the composition of gut microbes and boost levels of anti-obesogenic, obesity-causing bacteria. When used as a meat substitute, mushrooms also help with weight management. In one clinical experiment involving 73 obese people, mushrooms were swapped for red meat in the patient's usual meals. After 1 year, the mushroom eaters consumed fewer calories, had lower body weights, and smaller waist measures. Another 10-day trial discovered that replacing meat with mushrooms resulted in lower calorie intake and weight loss. May enhance blood pressure regulation. High blood pressure, often known as hypertension, increases the risk of developing heart disease and stroke. According to a recent research review, mushrooms contain bioactive chemicals that have been shown to help lower blood pressure. Some of these substances relax blood arteries, which improves circulation. Mushrooms may also help with blood pressure control since they contain vitamin D, and low blood vitamin D levels are linked to an increased risk of hypertension. May reduce the risk of depression. Major depression is among the most common mental health conditions in the United States. Approximately 21 million U.S. adults have experienced at least one major depressive episode. According to research, mushrooms contain a variety of bioactive substances that may help with anxiety reduction, including vitamin B12, antioxidants, and anti-inflammatory agents. The study is based on data from the 2005 to 2016 National Health and Nutrition Examination Survey, which is representative of all U.S. adults. Among the nearly 25,000 participants, those who consumed mushrooms moderately had a lower risk of depression than those who consumed the least amount. Mushrooms are also the richest dietary source of the amino acid ergothioneine. Ergothioneine is an antioxidant, and previous research has connected it to mental health advantages such as depression prevention. Supports brain health. Mushrooms may help prevent cognitive impairment, which occurs between normal age-related cognitive loss and the more dangerous disorder dementia. A Singapore study included 663 participants aged 60 and up. Adults who took mushrooms more than twice per week had a lower risk of acquiring cognitive impairment compared to those who consumed mushrooms less than once per week. The connection was not affected by age, gender, education, cigarette smoking, alcohol intake, high blood pressure, diabetes, heart disease, stroke, physical activities, or social activities. The researchers concluded that the data indicated the possible significance of mushrooms and their bioactive components in postponing neurodegeneration. Mushroom-related risks. Humans have been eating mushrooms since prehistory. Today, most mushrooms are commercially grown, assuring safer eating. Foraging for wild mushrooms may result in unintentional harm if a deadly species is mistakenly labeled as edible. Mushroom poisoning can cause gastrointestinal distress, liver or renal failure, seizures, and even death. To minimize these hazards, only buy mushrooms from reliable providers. Tips for eating mushrooms. Mushrooms can be eaten raw or cooked. Microwaving and grilling have been demonstrated to be superior cooking methods for preserving mushrooms' nutritional profile when compared to boiling and deep frying. Microwaving and grilling mushrooms were also found to improve their antioxidant activity. There are numerous ways to enjoy mushrooms. For instance, you could blend mushrooms into smoothies. Add mushrooms to egg or chickpea breakfast scrambles. Top avocado toast with sliced mushrooms. Mushrooms can be sliced or chopped and mixed into garden salads, soups, stews, chili, or stir-fries. Fill mushroom caps with a bean and vegetable mixture and bake as an appetizer. Skewer mushrooms alternately with other vegetables, then grill as kebabs. Mince mushrooms and combine with cooked lentils to make a ground beef substitute for tacos or pasta sauce. Mix mushrooms into meatless burgers and meatballs.